We'll conclude our discussion of the chest by looking at the remainder of the mediastinum. So first, let's make sure we know what the mediastinum is. The mediastinum is defined as the region in the chest between the two pleural cavities. And if we look at this lateral schematic, we can see how that's done. We make this imaginary horizontal plane at the level of the manubriosternal junction, which as we follow it straight back, reaches the vertebral column at the bottom of the body of T4. And we use that imaginary plane to divide the mediastinum into a superior mediastinum and then an inferior region of the mediastinum. But we then take that inferior region and subdivide it into three parts, using the fibrous pericardium as our landmark. And we say anything that is within the fibrous pericardium will be the middle mediastinum, whatever is in front of it will be the anterior mediastinum, whatever is behind it will be the posterior mediastinum. Now, we've already spent an extensive amount of time discussing what's in the middle mediastinum, so we don't need to do that any longer. The anterior mediastinum has nothing of importance for us to discuss, and so we won't. And so that just leaves us to discuss the posterior mediastinum and the superior mediastinum, which we'll do now. We'll start off with the superior mediastinum, and on this slide you can see that we can take the superior mediastinum and arrange the structures that are in it in a sequence of layers, working from the back to the front. So we see that the back wall of the superior mediastinum is the vertebral column. We see that the front wall of the superior mediastinum is the manubrium of the sternum, and then we have a series of structures that go from back to front. Okay, so let's take a look at those. So going back to this picture, we've put a line here to represent the separation between superior mediastinum and the inferior region. So this is the superior mediastinum. And starting from the back and working our way forward, we'll deal with those layers. The most posterior layer is the esophagus. So we'll look more specifically at the structures that comprise these layers of the superior mediastinum in a frontal view. And this is going to be important to us because these layers of structures will form the basis for allowing us to identify the structures on CT scans, which we'll do in a few moments. So let's turn to a frontal view. That line represents the separation between superior and inferior mediastinum. And so looking at the superior mediastinum, let's look at those layers. The most posterior or first layer is the esophagus. Immediately in front of that, the second layer is the trachea. The third layer is referred to as the arterial layer, and there are several arteries that comprise the arterial layer. Firstly, we have the aorta itself, but we can divide the aorta's contribution into three parts. We have a little bit of the ascending aorta, we have the aortic arch, and we have a little bit of the descending aorta. And then we also have the branches of the aortic arch, the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. So those vessels collectively, ascending aorta, aortic arch, descending aorta, brachiocephalic trunk, left common carotid artery, and left subclavian artery, comprise layer 3, the arterial layer. Layer 4 in front of that is the venous layer, and the venous layer is comprised of the superior vena cava and its two branches, the right brachiocephalic and left brachiocephalic veins. And then layer 5 in front of that, not shown on this picture because if it was there it would cover everything else over, is the thymus. So the thymus is in front of the veins, and then of course in front of that is the manubrium of the sternum. So we recognize that the veins are crossing in front of the arteries. Layer 4 is in front of layer 3. So we have the brachiocephalic vein crossing in front of the brachiocephalic artery or trunk and also crossing in front of the aortic arch. We have the branches of the aortic arch sitting in front of and sort of surrounding the trachea, and we have the trachea in front of the esophagus. We'll come back and look at that in CT in a few moments. Let's turn our attention now to the posterior mediastinum. And there are relatively few things in the posterior mediastinum, really only 4 structures of note, and only 2 of those 4 are worth mentioning here. We have the esophagus. We've already said that the esophagus is in the superior mediastinum. We said it's the most posterior structure of the superior mediastinum. And remember that this horizontal line that's shown here, or plane that separates superior from inferior, is imaginary. There really is nothing there to separate them. And so the esophagus just continues right on down from the superior into the posterior mediastinum. When it enters the posterior mediastinum, it is now the most anterior structure of the posterior mediastinum, which means it's directly behind the back wall of the middle mediastinum, which is the left atrium. Because remember, the left atrium is the back wall of the heart, and the heart is what's in the middle mediastinum. So that means that the anterior wall of the esophagus is right up against the posterior wall of the left atrium. The only thing separating them is the fibrous pericardium. And that's an important relationship because that would suggest that, for example, left atrial enlargement would impinge upon the esophagus and may cause, for example, dysphagia. It also shows that that very close relationship is what makes transesophageal echocardiography such an ideal procedure for imaging the heart, because you can put a probe into a transducer into the esophagus and have it sitting right here in the thoracic esophagus, and you're immediately behind the heart without any structures intervening. So you're able to get very nice imaging with transesophageal echocardiography. And there are many other clinically important relationships between the left atrium and the esophagus, but the anatomical basis for them is seen right here. The other important structure in the posterior mediastinum is the descending aorta, and simply note that the descending aorta is immediately to the left and posterior to the esophagus. The only other structures in the posterior mediastinum that can't be seen in this view are the thoracic duct and the azygos vein, but they're not important enough for us to deal with. So there's the esophagus, sitting right behind the left atrium, and there's the descending aorta sitting posterior and to the left of the esophagus.